For joining us. We'll begin momentarily. Good afternoon, everyone. Thank you so much for joining us for our October 2024 edition of Disability Connect. It's a pleasure to be with you today. My name is Nathan Turner. I'm an Outreach and Education Coordinator with the Ohio Life Force Nexus team at DODD, and we're delighted to have you. To quickly go over our agenda, we're having a brief welcome and Zoom housekeeping right now. I'll go over why Disability Connect is important, and then we will transition into what I hope is going to be a very lively discussion on self-direction and Medicaid resources from Nyoka Crenoff and Jolyn Carlson from the Medicaid Development Administration Division at DODD. And we will conclude with updates and questions and answer from Director Elk and other DOD leadership. To view captions in Zoom, you'll want to click on the captions icon, or alternatively, there is a link to open captions in a separate window. That link was just placed in chat, and if you need an ASL interpreter, what is present, they will be spotlighted and visible to you. And you also have the option of pinning them. Some additional reminders, we want to make sure that everyone is muted when you're not speaking so that we can reduce background noise. We encourage folks to use video so that we can more effectively communicate, but if you have to go off video for something, that's okay too. If you have a particular concern specific to you, we're happy to follow up on a one-on-one basis. And I want to remind everyone that today's session is being recorded. A little more about how we use our recorded data. So at this DODD event, photos, videos, and audio are recorded. By attending, you're agreeing to be included in the photos, videos, and audio we capture. Your attendance at the event is you giving us permission to be in the photos, videos, and audio, which may be used for educational, archival, or promotional purposes. As a very brief icebreaker, if you are able and you want to engage in chats, you can let us know your name, the county that you live in, and maybe about one of your favorite Halloween costumes. When I was thinking about this, I got to remember some of my childhood costumes. And one year when I was really young, around kindergarten time, I was a bumblebee in a homemade costume that my mom made for me because it was a challenge to find costumes that were accessible for me. And so I'll always treasure that memory. I'm not seeing any questions in chat, but if you do need the link for the captioning, QR code is there. And Ann Weissent is introducing herself, and she says that she and her brother were Raggedy Ann and Andy, which is very nice. Thank you. All right. Feel free to engage with us in chat, but because of time, I'm going to move us forward. Why is Disability Connect important for us? Disability Connect is really important for our leadership team to hear from many people living with disabilities across Ohio on the things that impact their lives. And as a reminder, if you have concerns specific to your personal situation, we're happy to follow up with you individually after the meeting. Keith says that one of his favorite costumes was a scarecrow from the community life engagement team, and I have to see pictures one day. But on that note, I am going to give a warm welcome to Nyoka Crenoff from our Medicaid Development and Administration team to have a conversation about self-direction.
Hello, everyone. Thank you for allowing me to be here today. I'm just going to talk a little bit about self-direction and the purpose of self-direction and what people in Ohio and across the country are using self-direction for. So we'll talk a little bit about that. Essentially, self-direction allows people to maintain independence and control of who, what, when, and how their services are provided. So it really helps people to have more flexible services and to have the control over the services that they are getting. And this really is self-determination and self-direction is a concept that applies to their Medicaid services, but also some non-Medicaid services too. It's really about people just taking control of their life. It's about a responsibility shift. It's helping people just really shift the responsibility and some of the control from the system to them. It can alleviate some workforce crisis pressures by getting the choice and some of those workforce issues into the hands of the person and their family and the people that they trust, because it's often individuals and people that they know. It's a more straightforward process for providing those services. So that's really important. A couple of key issues and key points of terminology that you would hear with self-direction that actually makes something self-direction is budget authority and employer authority. So I'd like to kind of talk about the difference between those two things. Budget authority is actually control over your money, your waiver money, and how that money is used and how much you pay. So in order for a service to truly be self-directed, you have to have control over those payment rates, so the amount of money you're going to pay that provider. And then overall budget authority in self-direction is just the ability to have control over your budget. And then employer authority is control over who provides your services. And both of those put, again, responsibility back on the person that's enrolled on the waiver and the people that help them self-direct. Who can help someone self-direct? Adults can really manage it on their own if they have the ability, or they can designate someone to help them. For minors, a parent or a guardian can manage the self-directed services. And we also have support brokers currently in the self-waiver. And there is currently a request for that to expand into other waivers. And then the financial management service, which is GT Independence in Ohio, can assist with certain parts, but they cannot. None of those people can also be paid service providers. So anyone who's helping with the self-direction pieces cannot also be the paid provider. And then just to talk quickly, so for the actual personal care service called participant-directed homemaker personal care, that service does require that you be certified in Ohio. So you still have to go through the certification process, but then you also are enrolled with our FMS GT Independence. And then you work with GT Independence. They help with some of the employer responsibilities, depending on whether you're considered a common law or a co-employer. And GT helps explain what those are and assist with, how to implement or how to get those things in place. So that's the personal care process. Nate, do you want me to continue or kind of see if we have any questions up to this point? I lost my screen because I was kind of looking at my
think
notes.
this is a great point to take a pulse check and see if we have some questions from the audience related to some of the things you discussed, maybe budget authority or employer authority, or the concept of self-direction in general.
Okay. Anything?
I'm not seeing any hands.
Okay.
This is Christine. There is also the co-employer agency with choice, which is where you agree with the agency to be the employer of record, but
Mhm.
you still have control over trying to help find staff. So that's another thing just to point out.
Okay.
Yeah, that's a really good point to bring up, Christine. I know a question that I have that people always ask me is, you know, we end up talking about the difference between self-direction and self-determination because the self-directed services might be really specific to a waiver or a specific set of services, but people can still have high levels of self-determination. Do you want to talk a little bit about that difference and how maybe people can somewhat self-direct or have a high level of choice and control over how they work with their team to get the things they want, but it might not be self-direction. Do you want to maybe
Mhm.
explain more of the difference between self-determination and self-direction?
Yeah, so I think I think self-determination is kind of exactly what you were just saying, Nate, which is I'm a very, self-determined person. I work great with my team and making my own choices and, putting in place some of my services, and some of them may be Medicaid services, some of them may be locally funded services, things like that. But self-direction, it is very specifically about budget authority and employer authority. You're working with the FMS. It's very specifically self-directed services. And so if I have an IO waiver, for example, right now in Ohio, there's only a couple of self-directed services in the IO waiver. So I might not have the opportunity to actually use employer authority or even budget authority a lot, but I may be very self-determined. And I may practice self-determination a great deal, but I may not have the opportunity to use a lot of employer authority or budget authority, or technically do a lot of actual self-direction in the technical sense. But I'm still very much using self-determination.
Thank you for that, Naoka. I think that's an important distinction. And I continuously remind folks that waivers are one way to pay for services. And part of being an adult living with a disability is really using those advocacy skills and communicating assertively and making connections and using what we have to get some of the things we want. And sometimes that might be a self-directed service, like, if someone would have a level one or self and use participant directed goods and services, or sometimes, it might be working with my team to find some options in the community that might be able to pay for things, or the county board might be willing to pay for things.
Right. And we can still achieve that through self-determination and working with your team to get that. Absolutely. Yes.
I think, do we have a question from? Okay, I think that may have just been cross chatter, but I know, do we see any other, do we have any other questions from the audience or any other feedback? I'm going to say feel free to move forward, Naoka,
Okay.
and then we can pause again when you
Okay.
finish for more
Yep.
discussion.
Okay, I just wanted to quickly mention a few of the services under self-direction too in Ohio. And so we did just bring up self-directed transportation in July of 22. And that seems to be going, pretty well for people. It did not meet all of the needs, certainly, but you know, it has helped, you know, fill in a few gaps. And so it does enhance independence. It is flexible for people. It is on-demand transportation for things like employment and volunteer activities, social events, and appointments. And so it does have those two areas where people can use it, either like using a family, friend, coworker, or using, you know, transportation available to the general public, you know, such as a taxi or a bus or an Uber, you know, Lyft, that kind of thing. So it has been, you know, helpful to people. Then we have participant directed goods and services, which is currently available in the Self and the Level 1. PDGS addresses needs that are not available in the other Medicaid services. So if the item is available in another Medicaid service, that service must be used. That's a requirement of the federal government. So such as a home modification or assistive technology, um, specialized medical equipment, those have to be used first. So that's key in that. And also it has to be required that it goes to Medicaid first if it's an item that can be billed to Medicaid or if it's for a child. So those are requirements of participant directed goods and services. Prohibited items under participant directed goods and services are things that are considered illegal. Food, no food can be purchased under PDGS. Actually, we were asked by CMS to make sure food was listed in all of our services as not allowed to be purchased. Alcohol, recreational equipment, and anything that's experimental. And so, and I really think it's important that people understand the authorization process as far as it's starting assessment and authorization at the county level. And so working with your county, making sure you have good communication with the county. So, you know, making sure that we are working together as a team and, you know, to get the best things we can for people. So that's basically what I have today around self-direction. Any questions on that?
I'm going to give people a moment to process their thoughts.
Okay.
I know that a few folks who couldn't be here today have asked some questions in the past about participant directed goods and services because we only have it available in a few waivers. And I don't know if we have plans to add that into more waivers over time, or if there are any other updates related to that.
Or which service? I'm sorry, I missed which one.
Participant directed goods and services.
So to go into IO,
Yes.
actually, yes, that is something that has been requested also. So I think that is something that's being considered.
Thank you.
Mm-hmm.
I don't know if there are any other questions or feedback from the audience. Did you have any other updates that you wanted to share, Naoka, maybe about waiver modernization or other things that the MDA team is working on?
As far as waiver modernization, we continue to work forward with, you know, trying to come to a final conclusion on assessment as far as, you know, the coming up with an assessment that is going to work for replacement of the DDP. So we're continuing to work, you know, through that. And then that's really probably where we're spending most of our time right now. So we've been, you know, very diligently working on that. So I don't really have much other than that, just that we just continue to work on that to come up with, you know, something that's really going to work and how we would implement that. and a transition and that kind of thing.
And the process for making amendments to the waiver, I know when I came on board to the department, that was one of the first conversations you and I had about how difficult or just it takes time. It's a time-consuming process to make changes to the waiver because of all of the different players and approvals that we need and have to work with as an agency.
Sure.
So it's not an easy process.
No, it definitely takes time. CMS generally asks for waiver amendments to be submitted 6 months ahead. They will take them at 3 months, but no later than 3 months. And so prior to that, what you're submitting to CMS, of course, we have to have completely done and agreed upon with Ohio Department of Medicaid. So we generally have to be working at least a year ahead of time, because we have to write rules that coincide with that waiver amendment. So we're usually working, 2 years probably ahead to get that waiver amendment in. So like right now we're talking about 2026, right? Because then we also have to get work done in our computer systems. So it's quite a time-consuming process. To get those decisions made and get everything done, to actually get it agreed upon internally with our stakeholders, externally, then with Ohio Department of Medicaid, and then get it written, because it's a long document. So it is a time-consuming process.
And people are curious about how they might provide feedback. I know there's the waiver policy TA email address. Is that
There is that. We also have, like, when we're actually in public comment, there is a waiver feedback mailbox that actual feedback goes into, and we're monitoring that closely, and then that gets documented and responded to. So there's a couple of ways to get feedback, to us that people see.
I think Christine Brown has a question, so I'm going to invite her to unmute.
Nayoka,
Yes, ma'am.
one thing I just saw earlier today, the Medicaid waivers from Ohio Department of Medicaid has self-directed nursing services. Well, have you ever thought of that to be a way to help with the nursing crisis? Because we did the study through our Nice Longer Center project.
Mm-hmm.
And the thing is, there's so much challenges with the nursing, and I had a link that I just sent to Mark Tasse and some others, and Carolyn Knight, and Rebecca Bates, that shows how they've made this where independents could, licensed nurses could be really hired under the FMS system as a way to help cut the shortage. Have you ever thought of that someday? Because I saw Medicaid did that in this just recently.
Okay. I'm certainly happy to look into it. I would be curious if it's making the certification quicker. I'm happy to check into it.
I'll find the link and send it to you, because I just saw it just a little bit ago when I was looking up things, and this is in the Ohio Home Care waiver and other Medicaid waivers that from the Medicaid department or the aging.
Okay.
Is the ones that they've added this stuff under self-direction.
Okay.
self-directed nursing.
All right. I'll take a look. Thanks.
Mhm.
Do we have any other questions for Nyoka? I'm going to scan just so that we can see. I am not seeing any other immediate questions for Nyoka. So if there are none, thank you so very much, Nyoka, for your time. I think this was a really insightful discussion about self-directed services, and I look forward to watching this space as your artwork develops.
Thank you so much. Thanks for having me.
Thank you.
Mhm.
And I see from chat that DoDD Director Kim Hauk has joined us. So I'm going to give a warm welcome to our director momentarily, but as a reminder, this time is for DoDD leadership to hear from people living with developmental disabilities across Ohio, and it gives you an opportunity to discuss the things that are impacting your lives. If you have a question about your personal situation, feel free to we'll follow up with you on a one-on-one basis and schedule something so that you can get the support you need. Having said that, I'm going to welcome our director, Kim Hauk. Thank you so much for joining us.
Thanks so much, Nate. It's good to be here with you, and good afternoon, everyone. Nate, as he always does, sent me a few topics to talk about and maybe have conversation with all of you. And certainly, please put in the chat or let me know anytime if there's something else or more that you'd like to talk about. So, like Nate said, it's a time we really want to hear from you and hear what's going on in your communities. So, first, I just wanted to mention that we at the department want to thank all of you for your input on our new mission, vision, and core values. I'll read them really quick for you. Our mission is to partner with people and communities to support Ohioans with developmental disabilities and their families in realizing their version of a good life. Vision is Ohio is the heart of opportunity, and we envision Ohio as the best place in the nation for people with developmental disabilities to thrive. And then our core values are inclusion, partnership, and respect. So I know many of you provided feedback through a survey that we sent out. And I know we talked about, a little bit about it on one of these calls. So I just, again, wanted to say that I appreciate all of you, and hopefully you see yourselves and your families reflected in these words, and you see the department carrying these out on a daily basis. Also wanted to talk just briefly about the county board governance, and now that all county boards are required to have someone on their boards with lived experience. It'll take some time for all counties to come into compliance. As someone's term ends, they will appoint someone new to that. And so we're really excited to see that start happening across the state. I wanted to make sure that you knew that Nate and folks on the team that work with him have put together a great resource on our website. So, I believe that he and others really got a lot of good feedback from you all. And, we want to highlight the importance of hearing your voice, both at the state level and the local level. And so we hope you can take a great, have the opportunity to participate in that. Nate, is there anything else that you wanted to say about that toolkit or, any of the other resources that you all have developed?
Certainly, I can speak to the fact that it's going to help folks understand what the time commitment is and what the expectations are of being a county board member. I know that serving on a county board might be different from other leadership boards in the community. So there are some specific instances that the toolkit covers. I know that folks are curious about working with someone supporting them and how that might impact their county board service. So that is also addressed in the toolkit, as well as how to start conversations around helping all the volunteer board members serve more effectively, whether they have a disability or not. So I would highly encourage folks, if they're interested in serving on a county board or even really serving on any sort of community nonprofit board or Rotary or something that would involve leadership with a nonprofit, to read that toolkit, because many of the strategies, particularly around forming a network or a community and using that community to find leadership opportunities, are things that might apply to any situation.
Thanks, Nate. The only other thing that I really thought I would mention is that this month, hopefully you all know, is National Disability Employment Awareness Month. I've had the opportunity, I went up to Williams County last week and be at a few other events celebrating. It's so nice to see and hear all the stories about people working in their communities, and I hope that you feel a great pride in what you're doing. And, we are an employment state, employment first state, and that's something we're really proud of. And so we will continue to support employment in any way we can. I know that team is also on, Stacy and Keith and maybe others. I'm not sure. I can't see everybody, but I don't know if anybody else wants to add anything.
I would like to chime in real quick because I was going to mention this anyway, so thank you for mentioning it. I just wanted to say we had a great time at Synergy, the conference up in Kalahari a couple weeks ago, or I think it was a couple weeks ago, and we did a session on people telling us about their employment stories, and it was really, really enthusiastic and inspiring because we just passed the microphone around the room, and everybody had a different story about where they got their job, how they're keeping it when they lost their job and got another one, how people helped them, and how they also got some stuff around some information around benefits. And so it was just a really great inspirational kind of session. And I think that's what NDEAM really is all about, is people kind of letting everybody know that the job they have, how they got it, and kind of the ways they can use the money they make to go on vacation and kind of just live the lives they want to live. So I'm glad you mentioned NDEAM, and I put in the chat to the National Disability Employment Awareness Month information from the Office of Disability Employment Policy. They kind of sponsor it, so there's a bunch of stuff there as well.
Great,
That's
thanks.
perfect. Thank you so much.
And I logged on just a couple of minutes late, but I heard Nyoka give a great update on, our waiver process and where we're at with that work. So probably isn't much more to touch on that, Nate, but if there's any other topics people want to talk about or any questions, that would be great.
I'm seeing a question in chat from George Agaby, and I'm just going to read it if that's okay.
Yeah.
Perfect.
I'm looking for an agency to find Egyptian one-on-one caregivers who have CPR certification and special car insurance to drive my vehicle.
Yeah. Yeah.
So you're looking for car insurance, and Nate, can you repeat the first part again?
I'm looking for an agency to find Egyptian one-on-one caregivers who have CPR certification and special car insurance to drive my vehicle.
So have you checked in with your SSA and your local county board first?
Yeah.
Okay.
I'll look for someone Egyptian.
He's looking for someone Egyptian.
Yeah.
Okay.
But I have no idea where I can look for one.
So I have no idea where I go for one.
Yeah. I would be happy to check with some folks here in the office and see if anyone has any good ideas. Maybe, you know, Tiffany or somebody can help us research that, because I'm not really sure either, to be honest.
Yeah. Because I need one who can look at my home.
Okay.
Director, this is Ann Weissant, DSP and Provider Support Manager for the department. We would be happy to also help and see if we can find any workforce resources around people from the Egyptian community. It would be helpful to know what county.
Oh, oh, oh,
Was that
I believe I heard Cuyahoga.
yeah.
Cuyahoga?
Yeah.
All right.
Great.
And Nate, do we have a way to get back with him? Or can he share his contact information with you?
I have his contact information and am in contact somewhat regularly, so we can get something coordinated.
Wonderful. We'll see what we can do and see if we can find any resources connected to the Egyptian community. I'm
Yeah.
sure that there are folks that are interested in employment, and we may be able to get them connected with provider agencies that are seeking
Okay.
direct support professionals. So we'll see what we can find, okay?
Yeah, because I want to get out of my home.
You know, want to get out more?
Yeah.
Okay. Great. Well, Anne will be in touch with you. Thank you.
Okay. Thanks so much.
You're welcome.
And I think sometimes when we think about self-determination and how that impacts provider selection, I know that folks have had a lot of success with reaching out to their community and maybe finding would not traditionally go into direct care who might have all of the other things they want in somebody who could support them. And they have a conversation about, you know, would you mind going through this process and helping me to make my life happy?
Yeah, thanks.
So I'm looking forward to the follow-up. And we have someone in chat saying they are a DSP and they're giving their phone number in chat.
Thank you for that.
You ever want to hear my next and my name and my email.
Yeah, we'll definitely follow up with you.
Okay. Yeah.
Thanks. Anyone else have a broad topic they'd like to talk about?
Director Hauk, it's Christine.
Hi,
I
Christine.
don't think you were on when I said this earlier, so I won't repeat it, okay?
Uh-huh.
I mentioned to Nyoka how the Medicaid department at the home care waivers, the My Care waiver, and the other waivers, they have a direct self-directed hiring nursing project that they've done where they trying to help with the nursing crisis. And since we did that nursing workforce crisis study, I saw that just earlier, sent it to Carolyn Knight, Rebecca, and others. And I think if the Medicaid department is able to do self-directed nursing, why doesn't DODD? As we are about self-determination here. So it might be something to look into so we can try to cut the red tape of this staffing and care crisis.
And did Nyoka tell you that she would look into it? Or maybe
Yeah.
talk to someone at Medicaid?
Yeah, I wanted
Okay.
you to know
Okay,
because
well,
I don't think you heard it. So.
yeah, I appreciate that. Thank you, Christine. Well, thank you, everyone. And Nate, I don't know if you have other people that we're gonna present today, and I'll be on for until the end. So if anybody thinks of anything, I'll be here.
And if folks who are here need, a moment or two to process questions, I can share some other updates from initiatives on our team as well. And then if folks want to ask a question in chat or just raise their hand, I'm happy to pivot back to them. So transitioning briefly to talk about some of the initiatives that we're working on at the Quality Innovation team, we have a transformative technology project with Med for All that focuses on AI-powered thermal cameras. And I know, Christine, you were heavily involved with this. I don't know if you want to talk very briefly about your experiences with it.
Yes, I was the one who recorded it, and the thing is, this camera is not where somebody sees you visually. It's so they can't see your body or whatever. It's like totally just by sound, okay? And the thing is, this camera is a way where they can detect if something's starting off. How is someone acting? Are they having any kind of stress? Are they about to have a seizure? Or are they about to have heart attack? This thing is about preventing something before it occurs is really the key. And trying to see that we get some people to use it. I'll be trying it out. Some friends of mine will. And we're trying to get this shown across the state. It also could help relieve stress for the DSP, so the DSP is not having to be eyes on all the time. Maybe they go around the corner. So and in this video, the mom talks, or sister, I don't know the relationship. They talk about how this device has helped her not have to be able, not need to be next to him. So I think this is a good kind of device for people to try. And number one, it isn't gonna cost on your Medicaid waiver. So it's a trial, and it can help detect health issues before it gets worse. That's the real big point. But you can share it and watch it. We're interested to have people, and we're offering this all over the state. Is
Thank
what
you, Christine.
Ali
That was
said.
really, sorry about that. Thank you, Christine. That was really helpful.
Sure.
I think in this case, it's an excellent example of how remote supports can really make a difference in the right cases to give people a lot more freedom and flexibility. And this is a pilot that is specific for people who have waivers. So that's important. But yes, it is available. And I thank you so much for that context, Christine.
Sure.
And I also wanted to talk a little bit about the Ohio Life Course Connect pilot treatment. So DODD is launching a pilot program to test an app called Ohio Life Course Connect. This app is going to help people with DD and their families with planning and resources. Again, we're looking for people all across the state who have waivers to give feedback on the app and shape its development. If you're interested, there is a QR code on the screen to sign up for the pilot. And I also wanted to point out that the Ohio Developmental Disabilities Council is seeking the opinions for what grants they're going to fund in 2026. All of the surveys are anonymous, but there is a link to take the 5-year plan survey in the chat. And I'm going to resend these things in the chat while you all, if you all have questions, you can think about them. And while I'm doing that, I also wanted to plug our newsletters and my DODD podcast. Disability Connection is the newsletter that I write monthly for primarily for people living with developmental disabilities, but it's also targeted for a wide audience, and it has things of interest for everyone, including the monthly DODD podcast that is released every month. As always, if you have questions about any of the things we've discussed today, or you have questions about any of the department's initiatives, the Ohio Life Course Nexus team is always the place to start for connection, resources, and information. Depending on your question, we may connect you to your county board or to other subject matter experts at the department, but we're happy to field questions and get you connected to the right person. Christine, did you have another question about nursing and self-direction?
I just put that link in there from the Medicaid department so that Nyoka and you guys would get it, because I thought, whoa, if Medicaid's able to do it, why is DODD not doing it? Interesting. So that's why I just sent it.
No, I wasn't seeing a link. I was only seeing text.
It's on the link. I think I'll double check. Because I copied and pasted that link. Wait.
I apologize. I didn't know if you were asking a question about nursing and self-direction or you were trying to share something else.
I'll try to find a way to share it again.
Christine, we received your link in the chat and it does work. So thank you very much for sharing that with us.
Oh, okay, thanks.
I just wanted to
Well,
confirm for you.
oh,
Thank
yes,
you.
I see it. The comment is separate from the link above.
Yes, it's separate, but that link was in there and it shows everything, so of just interesting to say, like, nursing self-direction waiver only, home care attendant waiver only. I don't know, I just searched this and it was like, wow, if Medicaid can do it, why can DODD? Interesting is all I can say.
Well, I think we have time for one more question. If anybody has a question they'd like to ask. Okay, I'm not hearing anything, so I can give a plug for our next meeting. I'm happy to do that. Our next meeting is scheduled for December 18th at 1 p.m. The topic is going to be virtual consumer protection from the Attorney General's office. So that is going to be a very interesting presentation on consumer scams and ways that we can protect ourselves online. So I cannot wait to have that meeting and hear this valuable information. And I just want to read from the chat. Sarah Davies says, no questions, but thank you, Nate and team, for the information and the space to ask questions and learn. Corey Hyman says, thank you so much. And I believe everything else in the chat.
And Nate,
Yes.
I was putting some information in the chat. It might be too large. I might have to just put the link. But just wanted to remind people of an opportunity for side-by-side learning for basic SSA training on assessment. And we are doing a side-by-side learning experience. So it starts with a virtual session for SSAs, and then there's an in-person opportunity. We're doing locations regionally. The information's in Memo Monday, and I'll put a link in the chat. But really trying to get teams to register so that the SSA and a person they support, a family member, a DSP can all kind of experience kind of those interactive activities together as a group. So we're looking really forward to a unique learning experience, and you can always reach out to me if you have additional questions.
Perfect. Thank you so much.
Nate, I did want to take a quick moment to share that we are having the annual Charting the Life course showcase on February the 20th in 2025 here in Central Ohio. There is a call out for proposals until November the 15th, and they're really encouraging people with experience and family members to consider providing a proposal to be a presenter for half an hour and share about how you might have used Charting the Life course in your life and how you've leveraged it to get to where you want to go or in the conversations and in guiding your life. So if that's something you're interested in, I have put the link in the chat. It's also available at the Family Resource Network of Ohio website as well. So if that's something that interests you, I'd encourage you to pull together a proposal and submit that to be part of the 2025 Ohio Charting the Life course showcase happening February the 20th.
Excellent. Thank you, Corey. I know that's always a fun time every year, and I'm looking forward to it next year.
I would like to piggyback on what Beth said. I'm with her in this SSA training. We would like to see more self-advocates. Some service and support administrators think they can just bring a group of 5 and no individuals or no family. We don't want that. We want the individual and a family member or their provider or friend that's in their support team and the individual and the SSA, because that's real teamwork. Just having 5 SSAs coming into this training and acting like the individual, one acting like the SSA and one acting like the provider isn't right. So I just wanted to point that out because I'm with Kelly Barnett and them on this project.
Thank you, Christine. We still have 5 minutes if anyone has anything else they'd like to share. Hearing none, I'm happy to give everyone 5 minutes of their afternoon back. I thank you so much for your candor and your willingness to come on to learn, connect, and share about your life experiences. And I look forward to seeing you all in December. Thank you so
And
much.
do we get a how do we get a certificate? Do we get a certificate for this, or how does that work?
For the Disability Connect meeting?
Yes.
No, there are no certificates for this meeting.
Okay, I was just wondering.
Thank you for asking for the question. Okay, have a good afternoon, everyone. Thank you so much for joining us.